Beyond death. As a resident ER, I've gotten used to the oddities of the night shift. It's exhausting and often boring. You talk in whispers, you scroll your phone, and if a patient calls, you assist them with minimal motions, trying not to wake up everyone else. But sometimes, that routine is broken by something truly insane. One of those nights came in very early in my career, and it left me completely and utterly shaken. At 2:30, a crash cart came in through the door. The patient was a female, mid-50s, with no history of heart problems. The notes didn't really match what I was seeing with my eyes. She didn't respond to external stimuli, and her breathing was shallow and uneven, with long, empty pauses. Her pulse was weak, and her skin was pale, like a person who's already halfway gone. And she had a documented "do not resuscitate" status. The monitor above her was giving tired little beeps. We kept an active eye on her for the next few minutes. One look at her told everybody where this was headed. No family, no visitors, no last hands to hold. We covered her up with some blankets and dimmed the lights. It seemed less like professional care and more like we were preparing her for her final moments. The end was coming. The least we could do was make it easy for her. Time passes slowly during night shifts, but on this night it almost came to a stop. The air was heavy, like there was a load on our shoulders. Any moment now. When the moment came, it felt like a relief. 2 nurses went and drew the curtains. No corneal response, no pulse. The attending did everything by the book and noted down the time of death. The monitor was disconnected, the lights were turned off, and we waited for the transporters to come wrap her up and take her to the morgue. But the transporters took their time, and the body stayed in the room. And then 30 minutes later, something happened that shocked the entire night shift. Restlessly waiting for the transporter, one of the nurses went to check in on the body. You do weird things when you're anxious. But just as she glanced through the curtain, she froze. She stood there transfixed for a moment, not responding to our calls. So we walked up to her, and we saw the wildest image we'd ever seen. The woman was sitting upright on the edge of the bed, her gown half off, her hair still disheveled, and her eyes wide open. A pure and innocent look lit up her face. How was this possible? This woman was pronounced dead, not 5 minutes ago, not 10 minutes ago, but half an hour ago. And then she stood up. She passed us by and started walking slowly in the hallway. Determined steps, like a woman looking for something she'd forgotten or lost. We were all too confused to stop her. What do you even do in this situation? What's the protocol? Is there a protocol? Eventually we got our act together and brought her back to her bed. We seated her, checked her vitals, and asked her if she was okay. The transporters were sent back. They were as confused as all of us. I walked away in utter disbelief as others attended to her. 2 hours later, as some of us went to the cafeteria, we were still discussing it. On our way back, we heard the beeping. Her cardiac monitor had gone off. By the time we peeled back the curtain, the line was flat. She lay the exact same way, the way she lay when her death was documented the first time. Was this a fever dream? The image of her bare feet across the hallway still haunts me. It's been years, and sometimes I find myself wondering, will I ever witness an event as bizarre as this ever again? The answer is a resounding no. Thank you for joining us on these journeys. I look forward to reading your comments and seeing your reactions to the stories. Do you have a similar story you've heard or perhaps witnessed firsthand in the ER? We'd appreciate you sharing it with us. If our content makes your spine tingle, make sure to hit the like button and share it with your friends. Subscribe to the channel for more terrifying stories. Who knows what kind of monsters await us in the dark? Join us next time to find